Hi everybody, and welcome to this week of AINS 205, the Patient Engagement Design course brought to you by Stanford Medicine X. This week we're going to be talking leveraging social media. We had our course participants from the MOOC who got to listen to Sarah Kucharski, an e-patient who blogs at the Afternoon Nap Society, and you can also find her on Twitter at Afternoon Napper. They also got to listen to Ronnie Zeiger and Jill Friedman of Smart Patients, who we have the pleasure of having with us today. We're going to be looking at the questions that were asked in the class this week, but also in leveraging social media in healthcare and the impact that it can actually have on driving change within healthcare. First things first, I'm going to have everybody introduce themselves after me. So my name is Britt Johnson. I am an e-patient advisor at Stanford Medicine X. I have had 2 forms of arthritis for over 20 years now. And I also live with chronic complex migraines, which if you were following me on Twitter yesterday, that's exactly what I was dealing with. So I'm an e-patient first, but advocate second. So unless they're sort of the same thing. So I'm going to jump to Ronnie and let you introduce yourself and tell us a little bit about yourself.
Hi everyone, my name is Ronnie Zeiger. I'm a patient sometimes, not mostly today. I'm a physician sometimes, although also not today. I spend most of my time working on health-related software, which is what I have been doing today, and that involves helping run an organization called Smart Patients, along with another guy that you'll hear from in a moment. And it's an online patient community for patients and caregivers, mostly dealing with complex illnesses.
Awesome. So if I could go ahead and have Gilles, if you wouldn't mind introducing yourself and tell us a little bit about what you're working on.
So my name is Gilles Friedman. As Ronnie said, we created Smart Patients about 3 years ago. And I've been building and managing online communities for cancer patients since 1995, when long before the term social media was invented. It shows how fast the world moves.
Absolutely. So I'm glad to have your viewpoint today. So Thomas, I'll let you introduce yourself and tell everybody a little bit about what you work with.
Sure. Thank you, Britt. My name is Tom Lee, and I am one of the co-founders, partners at a company by the name of Simpler. And I'm sure we'll talk a little bit about healthcare hashtags and throughout this, or 2 parts of this conversation today. I've worked in the healthcare field in one capacity or another for all of my adult life, 30+ years. I've been working in healthcare and have found the emergence of social media a few years ago myself, and it's been fascinating to watch it evolve and how it has become quite useful in the healthcare space.
Great. So Alden, I'll jump to you next and let you introduce yourself.
Thanks, you, Britt. So yeah, I'm also in working in Simpler together with Tom for a few years now, and spend my time looking a lot of data, mostly from social media and Twitter, looking at healthcare conversations online. And yeah, involved with a lot of different research projects, trying to find some great stories.
Wonderful. So, and we've got, last but not least, Kathy. So glad you're able to join us. So would you mind telling everybody a little bit about yourself and what you're working on right now?
Thank you, Britt. I'm Kathy. I tweet as ALS Advocacy. I also have a ALS Advocacy blog, and it's just my my passion in life to try to nudge the fight against ALS into some new and different directions, and social media have been a wonderful tool for that.
Wonderful. Well, we're so glad to have all of you guys, and it seems we lost Gilles for a minute, so hopefully he'll jump back in just a second. So I want to just quickly go over kind of the basics of what leveraging social media is about. So I'm going to throw this question to you first, Thomas. How is social media unique in spreading information, say, over other platforms that communities may normally go through, that being direct mailings or even in-person, support groups and so forth? How is social media unique?
I think the first thing that comes to my mind when you ask me that question is how universal it is. I mean, there are no boundaries, no geographic boundaries anyway. And I always think of rare disease communities as a perfect example where somebody with a rare disorder would have a very difficult time finding other people who are experiencing the same things as them, or perhaps experts who may be able to be of assistance to them in their geographic area. And yet social media, you can connect with somebody across the state, across the country, across the planet, and find that type of support and information, which otherwise would just become so elusive.
Yeah, absolutely. I always call Twitter the 24/7 support group because,
Exactly.
and I was just explaining that to someone a couple days ago, saying, oh, well, I'm on Facebook. Twitter's just another one of those things. And I said, yes, but, if I'm up at 3 a.m. and I can't sleep or something, there's someone that's up in Scotland that's willing to talk to me who knows, exactly what I'm dealing with. Yeah, so that's a really special thing about it there. And real quick before we go any further, because I know people are going to ask, and Alden, I'll go ahead and let you answer this. What is the image behind both of you? So do you want to describe a little bit about that and what it means, and where that comes from with Simpler?
Yeah, sure. So, we collect a lot of data from Twitter, and so that's conversations between people. And so what you see behind Tom and me is two different views of one of these communities that talk a lot. And it's basically called a network centrality graph. A node, I'm not sure if you can see, if there's a little, a little circle around here, that's a person, and then the lines between them, they connect, are actually true conversations and direct between them. So this is basically a snapshot of one of these communities, healthcare communities on Twitter, and it's beautiful, basically a piece of art, but it actually shows how real, dynamic, how deep they go. It's really connecting people, and I don't see any country borders here, no boundaries whatsoever. I don't see any differences between a patient and a physician and other third party. It's basically a visual of how social media sometimes can break down one of these traditional boundaries, traditional hierarchies within healthcare. So that's one of the things that Twitter and the other social networks do. They redefine some of these hierarchies and allow communication to flow differently than in the traditional healthcare setting.
Well, I think the really interesting thing about that visual is that it looks like a galaxy to me, when I first saw it. And I think that's what everybody thinks the first time that they see it, is that it looks like a galaxy, which is just supporting what you're saying about it being one large community, with no boundaries, not defining that, we're all kind of in it together, and we don't see the borders there, which is really interesting. And and I love watching the interactions between the bubbles, not knowing who it is, And Tom, you sort of brought up this idea that, Ronnie, I'm not sure, I think you coined this term, so I'm going to let you talk about it a little bit, but micro experts. So how would you define micro experts with us within social media, and how social media kind of helped create those?
Sure. So there's the concept of crowdsourcing, which most people are probably familiar with, but I'll allude to it for a second because I want to make a contrast to it. So crowdsourcing is the idea that if you have a question or someone has a question and you can ask the whole crowd, whether that's 100 people in a room or 1 million people on Twitter or similar, and you get everyone's answers and you take the average. That's crowdsourcing. So people have figured out that that's a really good way, for example, of figuring out how many jelly beans are in a jar. Most of us will guess pretty far off, but if we take the average of all the guesses, it's remarkably close. So Gilles and I have been talking about this for a while, and I've learned most of what I know about online communities from him. And we were talking about how to describe the following phenomenon. When someone joins something like a high-quality online patient community, and they have a question about something relatively specific, a subset of that community who has experience with that issue, they've recently talked about it with their physician, they've read up on it, they've been dealing with it, or all of the above, So they might chime in, and then 6 other people who have had that experience recently might chime in. And then someone else comes with a different question. Well, then it's a different subset of the network. It's a different 6 or 60 people that chime into that conversation. So none of these people are experts in the way we usually talk about it. They're not a clinician or a master researcher who is one of the people that knows most about this whole area. But for a specific question, they've been there, and they've done their homework, and they've talked to a couple of the experts. So they're micro experts. They're an expert in this particular thing. And the beauty of what often happens in online communities, which is part of this whole phenomenon of social media that we talk about, is that you get these networks of micro experts. And depending on what kind of question comes up, it's a different part of the network that steps forward to lead that conversation. And it's a totally different concept than the very expert-based culture we usually think about in education and in medicine and in other areas. This is it's sort of more collaborative and more distributed, and incredibly powerful and exciting and nurturing when it works well.
Yeah, the interesting thing about that is from time to time I actually get asked, oh, are you a doctor? Are you this? And which is very interesting to me when I'm sharing resources or information. And just because I am sharing those doesn't mean that I have to have, the certain letters that go along with my name or anything. We almost need that credentialing for patients that, you go past 20 years, you're going to have a certain body of knowledge that's worth that out there. So, it is very interesting to me how those typical assumptions can kind of bridge over into social media as well, but it doesn't matter because we do have the ability to continually learn from everyone. So, Kathy, I'm going to come to you real quick. How have you been able to? You said you personally wanted to fight fight the fight for ALS, which is wonderful, and we saw some really wonderful stuff with your community recently. So before the Ice Bucket Challenge happened, how was the ALS community using and utilizing social media to try to, get more awareness out there and get more research dollars? What were you guys doing before the Ice Bucket Challenge to give people perspective?
I think that with ALS, it's a particularly well-suited disease for social media because technology is so enabling to people who have the disease. It's not a disease where you can move about easily. People lose their ability to speak, yet they are able to interact online very well. So that's something that I think you need to keep in mind. Before the Ice Bucket Challenge, which I loved every minute of, I think that a lot of the things that we were able to do online kind of fell into two areas. One is in social media, I think you have a tremendous reach to journalists and to opinion leaders. And I think that many of us dealing with ALS in the social media were able to do some of that and raise the noise level a little bit. The other thing is I always call ALS the disease of reinventing wheels. There's a constant churn. The life expectancy of someone once you're diagnosed is not very long, 2 to 5 years. Some people don't last that long, some people last longer, but every new family who is faced with an ALS diagnosis, your head is spinning. You have a lot to do in a short period of time. And social media are very enabling. They let these micro experts that we just heard about help each other so that you're not always reinventing wheels. It's a difficult path. It's a fast path. People who have been there are able to help others very, very efficiently via social media, and I think that is has been a blessing for people with diseases like ALS.
You bring up an excellent point, is that social media really reveals and it makes the easier path. I love that, and I think that's what's really important to caregivers and to families, and that plays directly into the question that our course participants looked at this week. So what they were asked to consider as they were looking at social media and listening to the idea of leveraging social media is, have you ever played the role of a caretaker? If so, how did you educate yourself to perform that role? So that really plays into exactly what you were saying, because with doctors and so forth, they don't have a roadmap to how to fight the disease. The people who do are the people who have been fighting it. And so that's where it's extremely valuable, like you were just saying. So going back to the micro experts a little bit. Gilles, I'm going to come to you. I know you had some further ideas there, and would like to hear from you on that.
Sure. So the micro experts we're talking about haven't gone to a school to become the experts, and they don't have a diploma that is associated with it. They learn a lot about their disease, and unlike the expertise that most people get in a school and that ends up with a diploma, there is no power associated with it, and there is no money that is associated with that. People become experts, and they share with others what they have very easily, because that's what human beings do. They want to help others. And people stop wanting to help others really when money gets involved in when there is a monetary transaction. Here, in those communities, there are no monetary transactions at all. People help freely. And I think it's an element that is not sufficiently talked about when we talk about those tens of thousands of online communities where people help each other.
Yeah, absolutely. And I think that's really important to talk about is breaking down, having that, not having the money define, the conversations there and so forth as it normally would in, say, a clinical setting or a healthcare setting. So I really want to go back to this main idea of, leveraging social media, because I think we're going to have a lot of people out there ask, how do I leverage social media for my purposes, for my community's purposes, and so forth. So, I think a good kind of case example to look at is the ALS Ice Bucket Challenge. So, Kathy, do you mind telling us a little bit about how that happened in your community? And everybody wants to create the thing that catches on like wildfire, and so, where did it start in your community, and how did it work so effectively from your opinion?
That's literally lightning in a bottle, and I don't think you can do it again. It was a fortuitous set of circumstances. There were two young men with ALS. One, Pete Frates in Massachusetts, and the other, Pat Quinn in New York State. Just great young men with a horrible disease, and people had been dumping buckets of ice on their heads last summer in social media, and Pete Frates and Pat Quinn had kind of this idea that they could do some fundraising and some awareness raising to get their friends to dump buckets of ice on their heads. So this just kind of started, and I think you have to realize Pete Frates was a very good college baseball player. I met him once at an FDA hearing. He's the kind of young man that people would run through walls for, just a great guy. And he's also from the state of Massachusetts, where I think people in Massachusetts stick together and look out for each other. And it started catching on. Their friends were dumping ice and challenging other friends to dump ice or make a donation or both. And my personal opinion is that the night or the day that Ethel Kennedy dumped the ice, that was the day that everything broke loose, because Ethel Kennedy dumping ice on her head would make national news. And I think that was just a huge day, and it just took off. We saw Bill Gates, we saw all kinds of national people, many of whom had kind of these silent connections to ALS through a friend or someone they knew in the past, and it just got wonderful traction, and it never got old. I loved watching people dump ice on their heads.
I love what you said about lightning in the bottle, because that's literally what it was, and I saw so many other advocacy groups that, in the weeks that followed, trying to come up with their own way or their own thing to do in a video and so forth, but it wasn't going to work again. And I think that's, what people needed to realize is that it has to be unique, it has to be fun and interactive, and there's other ways to do it. And, I don't know if we'll see anything like that again in years, really. It was really fascinating, and I think that is kind of the prime example of leveraging social media. And I think the key there was calling out the friends. It wasn't just about, I'm doing this thing and you should do it too. It was, you should do it, and really, pointing the fingers and getting people involved in it, because everybody likes a good game of, kind of truth or dare there. I think it kind of played into some of our childhood instincts there. So kind of this idea of gamification as well, in technology. You make a game out of it, you make it fun, people are going to want to join in on it. So I want to go back to this original question that I started with that I asked Thomas, and I'm going to throw it to you, Ronnie, as well. Kind of from the smart patient's perspective, how is social media unique in spreading information from your perspective of smart patients?
So I'll answer in a way that's relevant to smart patients, but I think is relevant to probably any good quality online community, and it relates both to what Gilles said as far as power structures, and also the dynamic that is particularly involved with the caregiving question that you asked before. So putting my clinical hat on for a second, I do spend a little bit of time seeing patients, even though that's not most of my career anymore. I have noticed, now that I know a lot more about caregiving, how much I suck at helping patients' families deal with the illnesses that in many ways they are all going through. Frankly, it just wasn't part of my training. And we've noticed by accident that oftentimes a caregiver will show up into smart patients initially to try to make sure that their loved one is getting the best care possible for cystic fibrosis or lung cancer, or whatever the case may be. But then they find that there are a whole bunch of other caregivers also on the site doing the same thing, and they notice that they have a connection amongst each other that's really on a different axis or a different dimension. They don't share the same disease, but they're sharing a lot of the same experiences, whether it be around the burden of caregiving, the stress, the burnout, the financial strains, and so this sort of unlimited degree of kinds of connections among people who have walked in your shoes is something that is wildly different from what normally happens in the healthcare system. It's sort of, I mean, I view it as wonderfully complementary. Indeed, if you ask your doctor, hey, can you connect me with some of your other patients who are going through the same thing? The first thing that will likely go through his or her mind is, well, that's going to be kind of a pain from a privacy rules perspective. And not that that's an inappropriate thought, but I do kind of wish it weren't the first thought. I think in many cases, I happen to be a little bit of a privacy nut on the conservative side of things, although I think it should all come down to informed choice. But I think in many cases, some of the structures that we build into healthcare, like the privacy protections that have some very good aspects, also have some negative consequences about keeping people away from each other that could really be learning from each other. And so social media is and online communities in particular, and we can use lots of different definitions for something like an online community like patients, or a tweet chat, which is just a group of people hanging out together on Twitter. And it is a mechanism, a very low friction mechanism for people to ask each other questions. And you'll notice that the right people tend to step forward to have the discussion. When someone says something really inappropriate, you'll notice that other people say, hey, that was inappropriate, and here's why. And it's sort of like what happens in a really good quality in-person, a small good quality in-person community where everyone's willing to listen and learn, but in a way that's all of a sudden accessible by people almost anywhere with almost any rare issue.
Yeah, it's funny you say that, because I always say patients are very good at self-policing, and whether that be caregivers or anybody else, I think we're all very good at self-policing our communities, whatever the situation may be. And I think that's the hesitation of a lot of people to get on social media, whether that be patients or healthcare professionals or caregivers, because they're saying, well, is the validity of the information that I'm seeing good enough? Is this stuff that's just being thrown out on blogs really relevant? And the answer, I would say, on the large part, yes. You have to learn to educate yourself and to kind of vet your resources yourself, and don't take anything at face value. And as I always say, take this information, but then take it to your doctor as well.
And I can't help but interrupt with a slightly snarky comment. So take it with a grain of salt. But a question which we don't often ask is, when your doctor tells you something, you should double check it and ask someone else and take it with a grain of salt, because that person is also fallible and oftentimes is being asked to guide your decisions without getting help from anyone else. And that's kind of scary too.
Absolutely.
And that person also has biases that are not clearly obvious.
Absolutely, and I've seen examples of that just in the last few days on Twitter, with patients saying, "Hey, I just got back from, this is in my own community. I just got back from my rheumatologist. They're suggesting this." Someone yesterday with a migraine said, "Hey, my doctor isn't giving me the why of my migraines, but is willing to put me on 3 medications, and I'm not comfortable with that. What is your opinion about this?" And I've seen that a lot with patients saying, have you taken these medications? Have they worked for you? Doing exactly what you're saying there. Both of you are saying, taking that information back to the other community and bouncing it back, which I think is just as valuable. So Gilles, I'm going to come to you, and I have kind of a unique question for you. I see you a little bit as the godfather as some of these communities, and for caregivers, and I think you've been on there since I was playing Number Munchers and in grade school and so forth. So you're the guy to ask. But I know you got into these support networks because of caregiving, so that's very applicable. Would you mind talking to us? I know you had some points you wanted to bring in there too, but also about kind of how you've seen the internet grow, and then therefore social media grow the ability to share this information.
So the number and the size of those communities has grown exponentially, but the way the communication is going through those communities, regardless of the technology used, has not changed. It's pretty obvious that from the moment technology allowed people to communicate with one another directly, just like they could do on a telephone, it fulfilled a great need. If the healthcare system was working perfectly, there would be no need for us to talk to each other. It's pretty clear that because the system doesn't work as well as it has been advertised for a long time, it's our responsibility as patients and caregivers to go and get information. And I think that almost instantly we understand that we cannot do this on our own. If we go to look for information, regardless of how much education we have, and we do this in our own bubble, we are going to bring our own bias, and we won't be able to get the information that we need to provide the best care, either for us or for the person we care for. And those peer-to-peer communities are doing a job. I was almost thrown out of a meeting, I think, over 15 years ago, when in front of a few hundred doctors, I said, "I'm sorry to tell you, but those online communities are a new form of peer-reviewed publication." And that was, I think that I knew exactly what I was doing. It was the sentence that doctors just could not accept. But that's exactly what they're doing. Those communities constantly review the latest information, talk about it, and make sure that they don't direct people to misinformation or things that have no scientific basis. And that hasn't changed at all since '95.
I love the idea of the peer-reviewed information, because when we hear that, we think of it so much as being a scientific process, and not just as a process of our peers, which is truly, what it comes down to.
Sorry, can I interrupt you? Since we are talking about science, so those online communities, I think, are directly involved in helping create a new science. The science that has been used in the medical world is science that did fit the world of 50 years ago. And all of a sudden, when you have millions of patients that are talking to each other, there is a need for a new science. And it's not by chance that next May or next year, e-patient Dave is going to be the visiting professor at Mayo Clinic, where he's going to talk about creating the science of patient engagement. It's a defining moment in what we're all doing.
Absolutely, and that was huge news for those of you that don't know, and you should look him up on Twitter and online. E-Patient Dave, will officially the visiting professor, as Gilles said, at Mayo, which is a huge step in the right direction as far as actually sharing appropriate information. So I want to get back to, we talked a little bit about, kind of where we came from a little bit with social media. But as far as moving forward, where do we see it going? How can we progress it forward? How can we progress healthcare forward with social media? So, Auden, I'm going to come to you real quick. If you wouldn't mind telling us a little bit about what the healthcare hashtag project is, and then how that might help us kind of expedite, because that's how I see it, that it expedites information because it puts it all in one place. It makes it easier for us to find.
Sure, absolutely. So yeah, the short version of it, I think about 4 years ago, we just simply started from a very basic idea. We wanted actually healthcare practitioners, physicians, to adopt the use of social media, and mainly Twitter. So we created a very short list, 170 or so healthcare hashtags that was being used on Twitter that year. And shortly thereafter, we opened it up so that other people could submit a healthcare-related hashtag. And here we are today. I think we have over 5,000 hashtags. These are now covering not just professional, medical specialties as we started with, but also diseases, specific tweet chats, healthcare conferences, and so on. And so it grew, and we have been tracking these conversations. We now have over 600 million healthcare-related tweets, all categorized over 10,000 healthcare topics. And so what this is all a public website. So what we also see is now patients obviously adopting this, not just doctors as we initially thought would be. So they use the site. They come in. Maybe they have gotten a disease, maybe or a condition. They look it up, and immediately they will find other people interested or concerned about the same condition. So it's basically just a discovery platform, exploring hashtags, exploring people and topics. So one of the interesting things we've also seen lately is something called the Cancer Tag Ontology project, which is just a collection of 25 cancer-related hashtags. And this is being curated and driven by Dr. Matthew Katz and Patricia Anderson. And so I'm just thinking about that right now because we're just doing some research project with them and many other people. And it reminded me something about Ronnie said. So we were looking at these 25 cancer hashtags, and this is lung cancer, breast cancer, pancreatic cancer, and when we're tabulating, these are the physicians. We look at like the top influencer of each community. So we have a group of physicians, we have a group of patients, and we have a group of other third parties, which can be other healthcare organizations like ASCO and so on. But the interesting part there was that we saw patients, just like Ronnie said, jumping diseases. So we saw people that maybe had lung cancer jumping into the breast cancer conversation because they share related concerns, the same things. So we were trying to figure out the patients. Then we suddenly saw yes, it's a patient, but it's for their different disease. But they join the community and share and participate and support each other. So it's very awesome to see that happening.
Yeah, definitely. Well, and what I love about the Healthcare Hashtag Project is that it's not just hashtags that are, say, arthritis or rheumatology, like in my own community. It's not just the ones you would expect, but I can't tell you how you guys made my day when you accepted the hashtag PredMonster. And for anybody in the autoimmune community that knows what that is, it's prednisone. When you're dealing with high doses of prednisone, and anybody that has to take the medication, you understand that meaning there. The PredMonster comes to town essentially, and either A, makes you ravenous and eat everything in your kitchen, or makes you short-tempered with everybody else in your life. And it's a real thing, and it's real to patients, and it's a shorthand that we use, and I think it is really important to value even the things that kind of seem ridiculous amongst the patients. And one really interesting thing is recently when I had the chance to talk at Stanford in another one of the classes, I asked everybody there if they had heard of the hashtag Spoonie, and not a single one in the audience had. And you know, all the patients online that were viewing the class were just utterly shocked. He is such a shorthand to the patient community, and to us that is just you know, it's the first term that comes up in our own jargon.
I
So,
got to
Ronnie, do you have
butt in and share
Yeah.
two things. One is that I'm a pretty well trained physician, and I'm a pretty well trained nerd, and I fancy myself, you know, living really at the intersection of those things. And it was only in the last 6 months that I learned about the hashtag Spoonie, and I think that's wonderfully embarrassing and telling, given how central it is to so many people's identity. The other is I just wanted to give a plug, sort of a practical tip and plug for some of the work that the Simpler guys do. So for the people that are in this class and thinking about, okay, all this sounds really great, but is there something simple and practical that I can explore as a next step? Well, just think of something that you're interested in, whether it's a specific disease or a conference that you heard about, or a topic in healthcare that you care about, and go to simpler.com, SYMPLUR.com, and find a tweet chat about that, and it'll give you the schedule of what hour during the week it occurs at, and you can go to Twitter at that hour and learn a tremendous amount. And even if you just want to be an observer, just to get a sense, it's a transformative experience the first time you have it, to see and feel a really diverse population of people that are obviously coming from different perspectives and different geographies and different time zones interact with each other in this really intense, respectful way to advance the state of shared learning that's going on related to that disease or that drug or whatever it is. So that's a really easy thing to do, is find a tweet chat and just learn from it for 1 hour sometime in the coming week or two, and Simpler is a great starting point for that. And I have no financial relationships with Simpler to disclose.
Well, it sounds like you do, but that's a perfect lead-in to what I was going to ask next of Thomas. Is so we've got these great hashtags and hashtags like you know, Spoonie and so forth that we've discussed. So, you know, Thomas, how might people be able to you know, utilize some of these hashtags to better get their message out there, better share with doctors some of the knowledge that they have and so forth, and really grow their community?
Well, I think that exploring the website and understanding which hashtags are being used most frequently on these different subject matters, disease or otherwise. For example, diabetes has about 95 hashtags that we're tracking. And you can look through those and see which ones are most active or have the community that seems to fit your interest and needs the best, and who's influential in that conversation. And if you want to get your word out, who do you need to be connected with, or who should you be following? So it's like Alden said earlier, it's a great discovery tool to see what's happening in these communities and who the people are, and a tremendous way to make some relationships and to find some access to excellent sources of information out there.
Britt, you're muted.
I'm muted, thank you. Thank you. I was trying not to let my typing take over what Tom was saying there. So I think that's, you know, it's a really great point about, you know, trying to get, you know, the word out there. So Kathy, I'll let you jump in here. We haven't heard from you in a little bit. So have hashtags been really valuable to the ALS community? Have they helped grow and kind of, I see them as centralizing a conversation. You know, how have they worked for the ALS community?
I think it's particularly difficult in the ALS community. Even during the Ice Bucket Challenge, I was kind of taking the lead of the two young men who started it all with ALS Ice Bucket Challenge, which uses up an awful lot of your 140 characters, and other people were doing Ice Bucket Challenge, and with ALS itself, the ALS hashtag just doesn't work because you get all kinds of German conversations when you go and look for the ALS hashtag. So we're not there yet. I think people dealing with ALS, we have a lot to learn about finding that sweet spot of hashtags that makes you really more productive in your use of Twitter.
So does anybody have any some recommendations for her about maybe improving those. So we got the right people here to ask.
Oh, I think you should crowdsource a discussion. I think there should be a tweet chat. So this is serious. I'm not trying to be cute here.
No,
I think we should schedule a tweet chat to talk about what hashtag or hashtags could become semi-standard for the ALS community. And I bet you could get enough people to show up and get some terrific suggestions out of that.
Wonderful idea. Thank you.
See that we've solved some of our problems even right here. So, so that's the basis of it. So that, that's a great suggestion, I'd say, for all communities. Then, if you're looking to really grow and get your message out there more, or if you want to, try to come up with the lightning, that ALS created in the Ice Bucket Challenge, get together and have some of these conversations on there, or organize them a little bit. We've got a lot of great people joining us today. I'm watching the tweet stream here, and as Kirsten Schultz said, she also loved that Spoonie Chat, got recognized on there. The Spoonie Chat is, it's a great chat that takes place on Wednesday evenings, and then, if I'm wrong, please correct me, though, guys, on Twitter there. So, but they're able to share a lot of information there, share ideas, and problem solve there as well. So, so kind of playing off of this idea that we can grow our communities via hashtags and so forth. What communities are doing it right? And I'll let any of you jump in here. If you've seen an example of a community that's really doing it well, if they're leveraging social media either by banding together or by utilizing hashtags.
One that comes immediately to mind is the BCSM, breast cancer social media. I'm pretty early in my learning curve about tweet chats. I'm a pretty active Twitter user, but new to the tweet chat world, and they seem like they're really a model, both in terms of the sort of setup of it, but in terms of the highly collaborative and high quality discussion that's really multidisciplinary, both in terms of different stakeholders, different people in different roles, different parts of the breast cancer world, and also patients, clinicians, researchers. I think it's a model of the future. It's almost a model of the future healthcare system.
Sure. So BCSM is the role model, but LCSM is another remarkable tweet chat for a disease that carries a terrible stigma, and where it has always been so difficult to create communities that bring lots of people together, and that is going to allow to lower the stigma. That tweet chat is doing a remarkable job.
I'm not sure if I'm qualified or licensed to prescribe homework from this session, but if you're stumped and don't know what to do, I would pick one of those two. Hashtag BCSM for breast cancer social media, or LCSM for lung cancer social media, and attend one of those tweet chats in the next week to really experience what this stuff actually feels like.
Absolutely, those are prime examples. Thomas, I know you were going to jump in there. Were you going to bring up the same examples, or?
I was actually. BCSM is one that we've used in different presentations when we're trying to give an example to an audience about what a successful tweet chat can be structured like, and also, like Ronnie said, the variety of stakeholders that are active in that group is just really amazing, and it's such a helpful organization. Just the way that it runs, and the participation is excellent. Wealth of information can be obtained from that, and I always look to that one as being one of the models.
Let me add something. LCSM has, I think, another advantage, because there is so much scientific discoveries that are happening right now about lung cancer. The content, the scientific content that you have in this chat every time is of extremely high value, and the presence of the physicians, some of which are really leaders in the current research, really helps. Unfortunately for breast cancer, you don't have that much discovery right now, and so the conversations are really of a different nature. And so to speak about the homework that Ronnie was giving, I would say go and listen or follow both of them a couple of times, You'll be surprised.
I agree. I think you will be surprised. If I could also say that if you've never participated in a tweet chat before, it can go sometimes quite fast and be difficult to follow live for some of your first times trying it. And one of the things that we provide at the Healthcare Hashtag Project is a complete transcript after the chat is over with. And it's a permanent record that you can obtain either for the chat that just happened or any point in time since we've been following that particular hashtag. So you've got access to that, and you can read through it and check out links that were shared and whatnot. Don't be worried that you didn't catch it as it was all happening live.
Well, and I would say that's great advice because I'm using TweetDeck here, which works well for me. You know, and I've got a column for my stuff and for MedX and some other people that I follow in there, and it allows me to kind of keep that going because it can go extremely fast, like you're saying. There's also tweet chat as well, so you just kind of have to find what works for you to jump in there. But you know, the best way is, I think, if you're starting out, to just kind of be voyeuristic at first and really kind of watch and listen, and then you kind of learn the shorthand and the lingo there, because it can be a little intimidating to jump in, like you said. So considering this, what you know, before we wrap up here, going back to just the general idea of leveraging social media, I'd like to hear from each of you kind of one last point, and if you have anything else you'd like to bring up, what would be the one thing or one bit of advice that you would give to people if they want to leverage social media either for themselves as a patient or as a caregiver or as a doctor or a researcher or for their community? What would be the one bit of advice? So, Auden, I'll start with you. I'll put you on the spot there.
Yeah, no problem. No, so if you, for example, are looking into starting something, maybe there's awareness for a certain condition. Look at this example we just mentioned, BCSM, LSSM. I think that one of the reasons why they succeed is because they both have not only the patients there, but also the physicians and the third parties. And because of that, they get a lot of credit from these more traditional healthcare places. So, you know, in the future, you know, there might be some physician prescribing their patients certain hashtags. You got this condition, follow this hashtag. But you need to have all the stakeholders, you know, present in the community. So I see important.
I love that. I think that's brilliant. And I think with, you know, new disease, you know, they should be recommended to certain hashtags and so forth to find that information. It's been eye-opening, you know, when I've suggested that to people. So, Gilles, we'll go to you. You're next in line there. Do you have one bit of advice that you would have, you know, with communities or individuals trying to move forward while leveraging social media?
Don't be shy.
Simple and to the point.
Don't be shy, and with your determination, try something, keep on doing it, and don't be shy to ask the people who created BCSM, LCSM, and many of those chats for help to launch the topic that you want to cover.
Well, and I'll kind of give a great example of that. I've been having some trouble here, if anybody follows me on Twitter, with the State Disability Board, and someone finally said, why aren't you tweeting the governor, you know, and why aren't you calling the governor? And I thought, you know, why do we not think to go to the other people because of this hierarchy that we've talked about? And that's where Twitter breaks that down. And, you know, once someone just kind of gave me that nudge, immediately I did, and within 20 minutes, you know, I was getting answers because of that. And that's where the beauty really is of, you know, breaking that down. And it's a prime example of, you know, like you're saying, just, you know, kind of be bold in a way too. So, Ronnie, you're next in line there. So what would be your one big bit of advice?
I'm going to give you two. So one is me being a troublemaker for a moment, and that is ask a doctor what social piece of social media or online community they recommend, and the answer will probably not be a super useful one, but I think that's a question that we need to be asking clinicians more so that we can bring clinicians more into the conversation. So that's just me doing a little bit of advocacy. The more direct answer to your question is whether it's whether it's a tweet chat or a Facebook group or on Inspire or on Patients Like Me or on Smart Patients or somewhere else, find one community, get to know it just well enough so that you feel comfortable asking a question when and if you need to. It's almost equivalent to the advice that we sometimes give people when they're doing well, and that is make a relationship with the primary care doctor so that you know who to turn to when you do need something. I think there's a parallel case to be made. Find an online space that's comfortable enough for you that when you might need it, you know where you're going to ask your question.
Oh, I love that, and almost flipping the bill there, because I was thinking when you said that about going and asking a clinician. If I asked my doctor, I think my rheumatologist, though I love him, I think it would completely stump him. And I think he might tell me, well, WebMD, or he would go with the typical ones, the things that first come to mind, the Arthritis Foundation and so forth, kind of the bigger names. But, where are some of those other more specific or more, say, disease-specific communities as well? So I love that kind of pushing them, because that'll get them thinking, this is a need that I'm not providing to my patients currently, and what can I do about that? So Thomas, we'll go to you. What would be your one big or two big, since Ronnie went with pieces of advice on leveraging social media?
Well, I think that as you start to get involved, you'll find yourself going through an evolution. And at first, you'll be a consumer. You'll be asking questions. You'll be listening and just trying to learn the ropes, so to speak. But at some point in time, this goes back to one of the first things that was said here tonight when Ronnie was talking about the micro experts. You're going to become one of those. And the idea is to give back to these communities, to offer up what the insights are that you've garnered over your time and participation, and to be an asset back to that community. Because you just never know who it is that you're going to say something to at the right moment in time that can really make a difference. And that's really what social media is all about.
Definitely. And I love that you said that. And sometimes I think patients, will rely on social media obviously more when we need the support, but it's important for us to be there when we're feeling well as well, to be there for the other people. One great example, metaphor that someone gave me is a pod of whales, if you think about them swimming, and that when one goes down, they all go down together, and that we all need to go back up together. And I really love thinking of the patient community that way, really moving together. And like you said, kind of the randomness. I had posted something completely random on Instagram one day, and someone messaged me and said, because of this post, I got a diagnosis today, which, it seemed like to me the most random thing in the world, but that meant everything to me. So that is by far one of my favorite posts I've ever put out there now, because it was able to help that one person on that day get an answer where they hadn't had an answer. And you don't know what you're going to say, and it was, to me, something seemingly trivial, but it connected the dots there for that person. I think that's the importance of it. So Kathy, I'm going to try to come to you. You might have to try to unmute yourself at the top. I'm not sure if we can hear you. And if not, I apologize. We are having some tech difficulties over here. Yeah, we've got you muted there. So just before we wrap up, what I'm going to do, Kathy, we may not be able to come to you, and I apologize about that. We're having a little bit of tech difficulties here. I'm going to give everybody a chance to kind of give any one last thought that they might have, and then also tell us where they can find you online. If anybody would like to break down those barriers and talk with you guys a little bit more and ask some questions, where can they find you online or on Twitter? So Alden, you're first in line there, so we'll come to you next.
So yeah, you can follow me on Twitter, AUDVIN. I think that's the best place to reach me.
Great. And Gilles, I know you had a last thought, that burning thought you wanted to get out there. So.
Sure. So there is a beauty about those tweet chats. They are, I think, the best representation of participatory medicine. All those great tweet chats work because they're organized half by patients, patient advocates, and half by clinicians. And everybody works together in complete, like everyone is equal, and it shows how we are building a much better medical system with the integration and the direct collaboration of health professionals and patient advocates.
Wonderful. And where can people find you on Twitter then?
GFRY.
Got it. And he's the frog if anybody gets confused. So, and Ronnie, any last thoughts, and where can people find you online as well? Or any resources you want to point them to?
I won't plug anything else. I think I've done enough of that. But people can, you just put my name into the Google search box Ronnie Zeiger, and you can find my Twitter and my professional blog, and you can contact me through either of those.
Perfect, thank you. And Tom, did you have any final thoughts, and where can people find you?
Only final thought is give social media a try. I was a skeptic. Several years ago when I first got involved, I was a skeptic, and it quickly surprised me. And I have made some tremendous relationships, and it has been very worthwhile. So I encourage you to test those waters out. And you can find me on Twitter, is where I mainly hang out, and I'm at TMLFOX.
Great. Well, and I'm gonna echo what you said there about getting on Twitter and so forth, because I got on there, I thought, I should reserve this handle because that's connected to my blog, and maybe someday I'll need this. And little did I know it would quickly become my very favorite form of social media, the most impactful, the most able to help me reach people in a very timely fashion, whether that be New York Times journalists or just another patient that's having a bad day. So I think the power of Twitter is really important. And since we can't hear from Kathy here, I'll help her out a little bit. Oh, well, look at her. She's helped out. I was going to tell everybody. So her Twitter handle is at ALS Advocacy. Oh, she's a thinker there, problem solver. I love it. So that's all what being an e-patient advocate is all about, right? So yeah, sorry, my apologies to Kathy that we're having those difficulties, but you can find her there if you had any questions about what they've been able to do. Ronnie is having me also mention here about getting to meet some of the friends that I've made online. There's been that discussion here on the Twitter conversation right now about, are we friends if we've never met in line or never met in person? And I'd say absolutely. And the amazing thing is after I've known some of these people online forever, or doctors, patients, researchers, meeting them face to face, it feels like I've known them, my entire life, which is really amazing. And it's not awkward, whereas, I felt awkward sometimes in face-to-face support groups, but it's really an amazing experience to finally get to meet those people and get to have those discussions in person. So social media is really, really special, really important, and quite frankly, improving healthcare. So like Tom said, give it a chance, and I think that's the perfect kind of note to end on there. So I want to thank everybody for joining us this evening, and to our fabulous panelists for taking the time to help us out. And join us next week in the same spot, same time, next Wednesday at 4 p.m. Pacific Standard Time, and we'll continue our discussion. So until then, everybody have a fabulous evening, and we'll talk soon. Thank you so much.
Thank you.
Bye.